These people have come from Texas, North Carolina, Pennsylvania, and Massachusetts. Why are we protesting at the U.S. Department of Health and Human Services? We are here advocating for the rights of people with ME CFS.
We are Americans who have spent much of the past 10 to 30 years bedridden and homebound with a severe disability that was given a belittling name by our government, chronic fatigue syndrome.
Myalgic encephalomyelitis / chronic fatigue syndrome is currently the full name of our illness. It is an invisible disability. We often look fine, but many of us are severely disabled. Some of us have been bedridden for a long time.
This belittling name, chronic fatigue syndrome, sounds like we are just tired, and thus it does not reflect the seriousness of our disease.
But it certainly makes it easy for our government, medical community, and media to dismiss and ignore those who suffer with it.
However, if you have ME CFS, it is not easy to ignore. It stops your life. We lose our ability to work, attend school, or have a social life. Many of us are bedridden and using wheelchairs. Some of us have died early from leukemia and other cancers or health complications.
There are 1 to 4 million Americans alone sick with this disease. 17 million people worldwide. ME CFS drains 18 billion to 23 billion annually from the U.S. economy.
The U.S. government, media, and medical communities have delegitimized this illness and falsely psychologized patients.
This has resulted in very little federal money spent on research to discover the cause, treatment, or cure for this disease.
Then in 2009, the Whittemore-Peterson Institute found a retrovirus called XMRV linked to CFS patients. A retrovirus never leaves your body. It's there for life, like HIV.
Still, the FDA has not banned people with ME CFS from donating blood. The Red Cross has.
Today, we are here protesting to demand that Obama and Sebelius, Secretary of Health and Human Services, number 1, protect the nation's blood supply, ban people with ME CFS from donating blood. Number 2, fund research via centers of excellence just for this illness, including the Whittemore-Peterson Institute, the lab that first discovered XMRV's link to chronic fatigue syndrome. Number 3, fund fast-track clinical trials for treatments and medication. And lastly, number 4, act on the recommendations of the Chronic Fatigue Syndromes Advisory Committee recommendations. They have been ignored by our U.S. government for years, while patients and families suffer with a devastating illness. Please, we need your help. Now is the time to act. People with ME CFS. It has long been a tradition of our democracy that when a community of people feels their needs and concerns are not being heard by their government, they will demonstrate and protest. This is a tried and true tradition of any democracy. If we can have hundreds of our own mini protests like this one today of 1, 2, or 5 people happening around the country and around the globe, in front of our government offices, our blood donation centers and blood banks, we may cause some waves, get some press attention, and get some clinical trials and funding for ME CFS and XMRV research. Remember, protests and demonstrations, holding up a sign in public and stating your views are part of the democratic process. Let your voices be heard.